The efficiency of transcranial direct current stimulation as a therapeutic approach for major depressive disorder. The efficiency of transcranial direct current stimulation as a therapeutic approach for major depressive disorder. Depression is a very common and serious mental illness that affects individuals globally. Major depressive disorder specifically has been experienced by 5 to 8% of the population, according to Werner and Coffin's 2010. Although it is not 100% known, the physiological mechanisms of depression have been proposed by many researchers. A commonly proposed hypothesis is that major depression is caused by the hypoactivity of monoamine neurotransmitters in the midbrain, specifically serotonin, dopamine, and noradrenaline. This is thought to be related to major depression as antidepressants target the levels of these monoamine neurotransmitters and in some cases can cause an alteration. Tricyclic antidepressants can be used to prevent the reuptake of serotonin and noradrenaline neurotransmitters into presynaptic neurons. It should be noted that it is still unsure if the altered levels of these monoamine neurotransmitters is a cause or an effect of major depression. Another theory that has been proposed is that blood-brain-derived neurotrophic factor, or BDNF, a factor that measures neuroplasticity, is associated with depression. However, further research is needed on this as results are mixed. Research on major depression is crucial as depressive states can last for several months, interfering with behavior, mood, and physical health. If depressive states become extremely serious and are left untreated, this can lead to suicide attempts. Transcranial direct current stimulation, or tDCS, has become a topic of interest amongst many researchers as it has shown promising results in dealing with both neurological and psychiatric conditions. tDCS works by sending a constant current from one electrode, the anode, which is positive, to another, the cathode, which is negative. tDCS is a non-invasive method that has been used by researchers to study the underlying neural processes of many psychological processes, including working memory, language, mathematical cognition, and spatial attention. tDCS is not strong enough to trigger an action potential, but it can polarize the membrane of neurons by fractions of millivolts. A review by Nish et al. 2009 looks at the effects of tDCS on MDD by exploring past literatures. They propose that MDD is accompanied by altered cortical activity and excitability in prefrontal areas, showing a dysfunction in a distributed cortico-subcortical bihemispheric network. They hypothesized that altering this pathological state may offer a therapeutic method for MDD. tDCS can send a weak constant current flow through the cerebral cortex via electrodes. Using stimulation polarity, the result is a modulation of cortical excitability and spontaneous neural activity. Upon exploration of past studies, Nish et al. 2009 were able to conclude that most effects found in animal studies were similar to tDCS effects on humans, being that anodol tDCS enhances, while cathodol tDCS reduces cortical excitability. Results on the effect of tDCS on depression were mixed, which was attributed to large variability in patient populations, an example being that more severely depressed patients are more likely to be resistant to tDCS. A common problem in past research is not factoring in interhemispheric asymmetries. Further research is needed to determine the specific areas to target using tDCS to treat MDD. A more recent review of literature by Beneby and Haffen 2018 shows additional insight into the effects of tDCS on MDD. Upon reviewing several studies, Beneby and Haffen 2018 discovered contradicting results on the efficiency of tDCS as a therapeutic approach for depression. A study by Keller et al. 2012 showed high efficiency of active tDCS when measured against a placebo with a great reduction of depression scales. However, a study by Berlim et al. 2013 found no significant difference between active tDCS and the placebo responses. A third study by Brunoni et al. 2016 found alleviation of depressive symptoms when comparing active tDCS with a placebo, although this could be attributed to factors such as the number of sessions, the amount of energy delivered, or the level of antidepressant resistance. Beneby and Haffen conclude that tDCS is a promising non-invasive method that can be used to modulate cortical excitability and plasticity in varied psychiatric disorders and can be useful in treating patients with MDD who do not experience resistant depression. However, further research is needed for the exact stimulation parameters and the influence of add-on medications. Overall, transcranial direct current stimulation has shown promising results for the future of therapeutic approaches to major depressive disorder. Results have shown to be mixed. Evidently, further research is needed. However, an interest in tDCS continues to grow, with many researchers exploring the possibilities of its effects. Recommendations for further research include both the collaboration of antidepressant drugs with tDCS and the collaboration of psychotherapy with tDCS. The exploration of varied stimulation sites on treating major depressive disorder could also be beneficial.